Omicron is becoming that common cold, more mild-like illness where people may not have any symptoms at all, and that we're just picking it up.
By the start of 2022, Americans were understandably COVID fatigued and relieved that the coronavirus was getting milder on average. Hartford dropped its indoor mask mandate on February 1st. New Haven followed suit a month later. But that milder Omicron variant was so contagious that the sheer number of cases canceled out its decreased severity. Look at this. In the early months of the year, Connecticut still averaged 30 to sometimes 40 deaths a day. Those are numbers we were seeing back in our first COVID winter of 2020.
I don't think the public understands necessarily what we're still seeing and dealing with.
The wave died down by March and April, but the damage was done. We're on track for over 2,500 COVID-related deaths in Connecticut this year, which would once again make it one of the top 5 most common causes of death. We found out this year that U.S. life expectancy dropped for the second year in a row after decades of improvements. COVID was a big reason why, but so was opioid abuse. But at least 2022 brought some good news on that front. On March 3rd, Connecticut announced a $100 million settlement with opioid maker Purdue Pharma.
To do to people, and you had absolutely no regard for humankind when you pushed, lied, and peddled this to our physicians and marketed it as safe.
I think people who are responsible should go to jail.
More settlement agreements came later in the year, including ones with Johnson & Johnson and Walmart. By early July, Connecticut was focusing on its first case of a new virus.
I don't want to get monkeypox. The symptoms and stuff don't sound like fun, so I just want to, keep myself safe. And
thanks to public awareness and a vaccination campaign, Mpox, as it's now known, didn't kill anyone in Connecticut, and our state has had only about 150 cases. RSV, on the other hand, was everywhere. The respiratory virus hits babies especially hard. And by October, Connecticut Children's Medical Center said it was already over capacity, and Yale New Haven Children's Hospital was filling fast. Add in COVID and what's expected to be a worse than average flu season, and healthcare providers have had their hands full for most of the year. But 2022 was also a year of some great medical breakthroughs. That easily adaptable mRNA technology behind the original COVID vaccines led to quick development and rollout of bivalent boosters that better target the Omicron variants. Work is also progressing on a potential universal flu vaccine, one that targets 20 strains. mRNA is behind that too. And just last month, a breakthrough in Alzheimer's research, a drug that appears to slow symptom progression by over 25%.
This is the holy grail. This is the thing that we've been, looking for all this time.
I'm Tim Lammers, Fox 61 News.